This is a Brooklyn News special report.
Good day, good to be with you here. I'm John Mitchell. We're coming on the air at this hour as Republican President Donald Trump and RFK Jr., the Health and Human Services Secretary, are set to make an announcement on health. We're learning late today that that announcement is specifically on autism. Let's take a listen now as they make that announcement.
We're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz, and Acting Assistant Secretary of HHS, Dr. Dorothy Fink. So thank you all. Thank you, Dorothy, very much. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys. 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000, and then you go to 12, there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you can't tough it out, if there's a problem, you're going to end up doing it. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period. Take it over 5 times or 4 times, but you take it in smaller doses and you spread it out over a period of years. And they pump so much stuff into those beautiful little babies. It's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And it's artificially induced. It's not like something that when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it. And that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact. So let those be taken separately. And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about. I mean, this was mostly going to be on how not to have the child affected, but we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can get better. and in some cases maybe substantially better. Not going to be easy, but be a lot easier if it didn't happen in the first place, as these great parents fully understand, right? They fully understand. I feel so terribly for. I have so many friends with autistic children. It's a tough situation. Finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot. And I want to say it right now. And, you know, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on the subject for a long time. You know, life is common sense, too. And there's a lot of common sense in this, and I wish things like this were brought up. And this group has worked so hard on it, but I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quicker. There's absolutely no harm. At worst, there's no harm. Thank you very much. Bobby, please.
Thank you, Mr. President. To meet the President's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. We have broken down the traditional silos that have long separated these agencies, and we have fast-tracked research and guidance. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development. We have also evaluated the contrary studies that show no association. Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health. FDA also recognized that acetaminophen is often the only tool for fevers and pain in pregnancy, as other alternatives have well-documented adverse effects. HHS wants, therefore, to encourage clinicians to exercise their best judgment in the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required. Furthermore, thanks to the politicization of science, the safety of acetaminophen against the risk of neurodevelopmental disorders in young children has never been validated. Prudent medicine, therefore, suggests caution in acetaminophen use by young children, especially since strong evidence also has associated it with liver toxicity. Some studies have also found the use of acetaminophen in children can potentially prolong viral illnesses. FDA will drive new research to safeguard mothers, children, and families. In addition to a possible acetaminophen connection to autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism. We have also identified an exciting therapy that may benefit large numbers of children who suffer from autism. Peer-reviewed literature has documented that up to 60% of folate-deficient children with ASD can have improved verbal communications if given leucovorin. I have instructed NIH, FDA, and CMS to help doctors treat children appropriately. Jay will help tell that story, which started with sound science, the kind that restores faith in government. This announcement also represents a historic collaboration between NIH, FDA, CDC, and CMS. We expect this to be the first of many announcements over the coming years that deliver actionable information to parents on underlying cause of autism and the potential paths for prevention and reversal. Finally, autism is a complex disorder with multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. President Trump believes that we should be listening to these mothers instead of gaslighting and marginalizing them like prior administrations. Some of our friends like to say that we should believe all women. But some of these same people have been silencing and demonizing these mothers for 3 decades because research on the potential link between autism and vaccines has been actively suppressed in the past. It will take time for an honest look at this topic by scientists. But I want to reassure the people in the autism community that we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find. We are researching this issue to all 3 agencies. Jay will discuss one of our research initiatives at NIH. This model of unleashing unbiased, depoliticized, gold standard scientific research and academic freedom to deliver actionable information to prevent and reverse disease will be a model for the framework to deliver similar results for many other chronic conditions that plague Americans. Jay?
Thank you, Secretary Kennedy, and thank you, President Trump.
Thank you very much.
I'm proud to announce today that the NIH has launched the Autism Data Science Initiative to turbocharge autism research, devoting an additional $50 million to the cause of studying autism. Nearly 250 research teams from across the country applied, sent in their applications and were peer reviewed by the NIH review panels. The NIH review peer reviewers chose the 13 best projects focused on root causes and therapies with replication and validation studies to guarantee gold standard science. The studies feature a new kind of science called exposomics, where scientists consider environmental and medical factors, nutrition, events during pregnancy, in combination with biology and genetics to answer vital questions about autism. Science like this, conducted in partnership with families and physicians, is the best way to arrest and reverse the autism epidemic. Autism spectrum disorder encompasses a very wide range of symptoms, ranging from mild difficulties with social interactions to profoundly autistic children who experience severe disabilities in speech and behavior. Given this wide range of symptoms across the spectrum, it seems certain that there will be a wide range of biological contributors to explaining the cause. The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem. The sharp rise in the prevalence of autism deserves an urgent response by the scientific community. As Bobby said, the NIH has invested a lot of money to study autism over the years, but the research has not produced the answers that families and parents of autistic children deserve, and autistic children themselves deserve. For too long, it's been taboo to ask some questions for fear the scientific work might reveal a politically incorrect answer. Because of this restricted focus in scientific investigations, the answers for families have been similarly restricted, often pointing families to behavioral therapies that don't work for every kid or suggest non-modifiable genetic factors as the cause. But genetics alone can't explain such a sharp rise in autism prevalence over just a few decades, as the president said.
Alrighty, we have been listening in there to Trump and a number of the members of the cabinet there and really just the executive branch speaking on this new announcement that we are just getting in on autism. That announcement, I'll just read it here, kind of what we know, what my notes are, as this, again, we are learning about this announcement. It is related to Tylenol causing autism. Here is what they are saying. They say if you take Tylenol while you're pregnant, that it could lead to that child, once birthed, to having autism. They say, as President Trump adding that aspirin and Advil can also cause this. RFK Jr. says a potential finding in taking Tylenol. I noted that because he said potential. He said that keyword there, potential linking in taking Tylenol. So I think using language like that, I mean, does that bring up a question? Maybe what was there a finding that it is definitive? This is only potentially. So that is something that I'm sure a member of the press might consider asking. They say a potential finding, while President Trump and the others there now speaking haven't said anything quite like that. But it could be President Trump did say that the RFK Jr. was watching what he was saying. We'll see there. So we're going to continue watching that. HHS will launch a PSA, a public service announcement on the new finding, and to not take Tylenol while pregnant. Those are my notes, kind of what we learned here. Again, the president, the HHS secretary, excuse me, they're saying that there has been a findings saying that if you take Tylenol while pregnant, it could lead to that child having autism. Trump saying to only take it if you have a very high fever or in severe cases, and that it should be spared when you take Tylenol. That is going to wrap up this Brooklyn News special report. Thank you all so much for watching. Catch you all again soon.